Hi everybody, and welcome to our Mastermind patient registration processes for CTG, PPS co-payment measure and PIP Indigenous health incentives. My name's Jenny Pearson. I'm an education officer for the Primary Health Network and I sit in Armidale. Today I have Heidi Avery, who's a primary care improvement officer, Jess Griffiths and Malika Riley, who are both part of our Aboriginal Health Access team. There will be an evaluation that will pop up after the webinar today, and we just ask if you could take a few seconds to fill that in, and you will get a certificate of attendance tomorrow with a follow-up email telling you where you can access the recording and the slides of this mastermind. I'm just going to hand over to Jess, who will do an acknowledgement of country. Thanks, Jess.
Thanks, Jenny. Hi everyone, my name is Jess. I'm part of the Aboriginal Health Access team at the Primary Health Network. I'd like to take this opportunity to acknowledge the various First Nations we're meeting on today, countries of which the boundaries are known and lived through our Aboriginal communities across this region, not by the modern borders and regions we see today, but by the natural landscapes of the land itself. I'd like to acknowledge the Awabakal land I'm joining you from in beautiful Mullabimba, or Newcastle as it's also known. But please take a moment to acknowledge the Aboriginal country you are joining us from today. Know its name, its people, think about what its Aboriginal culture, law and history mean to you. I'd like to honour the traditional owners of these lands, our First Nations elders, past, present and emerging leaders. We have ancestral ties to these lands, oceans and waterways as the first people of this country for more than 60,000 years. A sacred link that the last 200 years simply cannot extinguish. So by acknowledging these lands and its custodians, we're acknowledging our First Nations people, sovereignty and history. I'd also like to extend my respects to the Aboriginal and Torres Strait Islander people joining us in this mastermind today and those joining us in the recording later on. You may walk in two worlds, but your culture, the oldest continuous living culture in this world, is a gift to this country. Yes, so we always were, always will be on Aboriginal lands. Thank you.
Thanks, Jess. Jenny, do I have control of that?
Yeah, just flick to the next slide.
Yeah, it's not moving.
Okay.
While Heidi and Jen are setting that up, I just wanted to make note that if you're joining us in the recording of this session today, if you're outside the Hunter, New England and Central Coast regions and you have got some questions, please contact the relevant Primary Health Network for your region. Additionally, if you're outside of the New South Wales region, please check any state-based PBS guidelines and or reforms.
Okay, we're underway now. Thanks, Jess. Welcome, everyone. We'll start by just running through our learning outcomes for today. So we're going to look at how to register a patient for the Closing the Gap PBS co-payment measure, how to register a patient for the Practice Incentive Program Indigenous Health Incentive, how to check if a patient is registered for CTG and PBS and or the PIP Indigenous Health Incentive, how to check if a patient is registered, and HPOS delegation. So hopefully we can clear up the confusion around the processes and to make sure that your patients have been registered appropriately and your practice receives the practice incentive payment. So Closing the Gap PBS co-payment measure. So health professionals can help Aboriginal and Torres Strait Islander people access low-cost or free PBS medicines by registering them for the Closing the Gap Pharmaceutical Benefit Scheme co-payment. So who is eligible? You only need to assess a patient's eligibility once. So a patient is eligible if they self-identify as Aboriginal or Torres Strait Islander Australian, will have setbacks in preventing or managing their condition if they don't take their medicine, are unlikely to keep up their treatment without the help and the cost, and are enrolled with Medicare. So their age, where they live, and their chronic disease status doesn't matter. So a point to remember is the person only needs to be registered once, and it's for all ages for this part. It doesn't require a patient to have a chronic disease. So important updates for prescribers. So since the changes to the CTG PBS co-payment program were introduced on the 1st of July 2021, it has emerged that some Australian and Torres Strait Islander people who were previously receiving the PBS benefits are not actually registered for the program through Services Australia. So the department, together with Services Australia, have implemented a grace period from the 12th of July 2021 to the 30th of September 2021. So the grace period will prevent CTG annotated prescriptions being rejected at the time of dispensing if the Aboriginal and Torres Strait Islander person is not formally registered in the new centralised database. So during the grace period, if a CTG annotated prescription is presented by an Aboriginal or Torres Strait Islander person and they are not correctly registered, the CTG prescription will still be able to be dispensed. So let's look at what is changing. So a new centralised patient registration database went live on the 1st of July 2021. So that's a new tile in PRODA. So also any PBS prescriber or Aboriginal health practitioner can register eligible Aboriginal and Torres Strait Islander people for the program. Eligible people can be registered for the program no matter where they live and regardless of their chronic disease status. The registration of eligible people will be via the health professional online service. This registration will cover Aboriginal and Torres Strait Islander people, even if they move to a different health clinic. Practitioners will no longer be legally required to write CTG on the prescriptions. However, annotation of a PBS script will help pharmacists know that the patient is registered. Any PBS prescriber can issue PBS general schedule medicine prescriptions for Aboriginal and Torres Strait Islander people that are registered for the program. And the PBS prescriptions issued within a public hospital will now be eligible to be dispensed by any community pharmacy or Section 94 approved health private hospital pharmacy. So what's not changing? So the program will continue to be for self-identified Aboriginal and Torres Strait Islander people of any age. Aboriginal and Torres Strait Islander people that are already registered for the program will continue to be registered, and current registration details will be transferred to the new database. Aboriginal and Torres Strait Islander people will still need to be assessed by the practitioner as being eligible for the program registration. So setting up delegation. So the provider will need to have a PRODA account, and to appoint a delegation, you will need to go into the My Details tile, so where I've got the red box drawn there. You'll click on the My Delegates to add your delegation in. And you will need to have an RA number for the person that you are wanting to delegate. This slide is just to give you a view of what your screen should look like when you're amending delegation. So you can tick and untick various areas of delegation functions in there. And these next two slides, I've just put these in as their step-by-step instructions on setting up delegation. So I've just popped them in there for you for future reference. So registering a patient for CTG PBS co-payment measure. So the process to access the PIP Indigenous Health Incentive and PBS co-payment measure is through HPOS now. So to access this, you will need to click on your My Program tile. You will then click on the Closing the Gap PBS co-payment register tile to start the registration process. So that's the new tile that they've just introduced. But just be mindful that your layout might look different to what you're seeing here on the screen. It will just depend on what you've already been approved to see. So you will then be taken to this section. So this is your Closing the Gap PBS copayment register. So this is where you will search for your patient. You can then search by name or Medicare card details. And the bottom section that you'll see here in the red box is where you'll be able to see if your patient is registered or not. So my sample here, the patient was active, but if someone is not active, it'll have not active, and it'll allow you to click on it to actually register. So registering a patient for the PIP Indigenous Health Incentive sign-on payment. So this section, for your PIP Indigenous Health Incentive. So it comes in 3 parts. So you've got your sign-on payment. So this is a one-off payment for practices that agree to undertake specific activities to improve the provision of care to the Aboriginal and Torres Strait Islander patients with a chronic disease. So the practice will get that as a one-off payment. Then you will get your patient registration payment. So that's for each eligible patient per calendar year, and that's a payment to the practice for each Aboriginal or Torres Strait Islander patient aged 15 years and over who is registered for the practice for the chronic disease management. So there was a little bit of talk and a little bit of confusion around this section, because with the announcement from the budget, there was a little bit of talk about them dropping the age altogether and just registering for anyone that's got a chronic disease. But that's now been withheld until 2023, I believe. So when that does become available, we will let you know, but just be mindful that it's not current at this stage. So then we have your outcome payment. So these are made up of 2 payments. So you've got your Tier 1 payment, and that's calculated again for each eligible patient per calendar year. And it's a payment to practices for each registered patient where a target level of care is provided by the practice in a calendar year. And the payment per patient is made to practices that prepare a GPMP or coordinate the development of a team care arrangement for the patient in the calendar year, and do at least 1 review of the GPMP and the TCA during the calendar year, or do 2 reviews of the patient's GPMP and TCA during the calendar year, or contribute to a review of a multidisciplinary care plan for a review in a residential aged care facility twice during the calendar year. So then you've got your Tier 2 payment, and that's eligible, that's calculated again for eligible patients per calendar year, and it's a payment to practices for providing the majority of care for a registered patient in the calendar year, and it's a payment per patient is made to the practice that provides the majority of eligible MBS services for the patient. So with a minimum of any 5 eligible MBS services during the calendar year. So an Aboriginal and Torres Strait Islander person will need to have had or been offered a 715 health check to be eligible for the patient registration payment. So in your software, you will go into the letter writer or the word processor, depending on your software. So I'm just using best practice as an example today. So you should have a form already listed in your supplied section as the PIP Indigenous Health Incentive PBS registration and consent form. So this is an IP 017 form. So if you don't see it in there, you can download the RTF document from Services Australia website and import it into your software. But this is the registration form that you need to complete with the patient, and the patient must sign the consent form. And you will need to keep this for auditing purposes. So registration for the PIP Indigenous Health Incentive and the PBS co-payment measure are independent of each other. So a patient can choose to participate in the PBS co-payment measure and choose not to participate in the PIP Indigenous Health Incentive, or vice versa. So this is the next step to your PIP registration. So you know how once you used to fax off all of these, like your registration forms, to Medicare? Well, this is a much faster and more reliable way to ensure that your patients are registered for the incentives and that your practice is going to get your payment for eligible patients. So practices, what I have personally seen, practices that have been continuing to fax their registration through to Medicare haven't always received payment for it. So it hasn't actually made it to the other end, where if you're going to do it through HPOS, you're going to be able to check to see what patients have actually been registered, and you can cross-reference that against your PIP statement. So you need to be linked to the practice or go through your My Providers to access the My Programs tile. So your My Provider tile is just at the top of your screen there with the red box around it. So to be able to access the PIP tile, you will need to be a primary or secondary contact for the practice for the PIP purposes. So an easy way to check if you have got access is if you click on the PIP tile, and then you should see an update button on the right-hand side. So I've just put a little red box around that one. So you need to look out for your update button. You would click on that one, and that will you'll be able to proceed into your PIP section. So if you don't have access and you have been advised that you can have access, then you will need to complete the practice incentive change of practice details form. So that's an IP 005 form. So you can just download those forms straight from the Medicare Services Australia website. So in the main menu on the left-hand side, you would click the Indigenous Health Incentive and then the patient registration section. And then you'll only need to search under the top search function, so criteria 1 with your Medicare card details and your patient name, or you can search in the lower section, so your criteria 2, and that's if you don't have a Medicare card number for your patient. So you only do one or the other, you don't need to fill in both sections there. So this next section, so this is all of the questions that were answered on your patient's form that you done, your IP 017 form. So that's the one that was done in consultation. So you need to enter all of that in there and submit it for registration. So you must keep the IP 017 form, as this is where your patient has consented to the program, and I would suggest scanning this back into your patient file. So what are the requirements? So for practices to register for the PIP Indigenous Health Incentive and the PBS co-payment measure, practices must self-identify to the GP or the practice staff as being Aboriginal and or Torres Strait Islander of origin. So patients do not need to provide evidence to support this. At least 2 staff members from the practice, one must be a GP, must complete appropriate cultural awareness training within 12 months of the practice signing on to the incentive. So where a staff member, including a GP, counted towards meeting this requirement leaves the practice, another staff member of the practice needs to meet the training requirements or be considered exempt. So this needs to happen within 12 months of the separation date of the previous staff member. So this is one area that always gets missed if a patient leaves the practice. So please refer to the Services Australia and the Practice Incentive Program Indigenous Health Incentive Guidelines for further guidance around that. But to register for your training, that's usually done through RACGP or ACRM. So I've got some resources listed here and some fact sheets. So you will be able to access, and we will go across to any questions. So, but just before we go to the questions, I just want to say, like, a couple of takeaways from this presentation are the registration process is a two-step process for patients 15 years and over that have a chronic disease. And CTG PBS copayment measure is a once-only registration process, and it's for all self-identified Aboriginal and Torres Strait Islander patients. So the only changes that have really happened are that they've actually separated the two. So before the 1st of July, you used to just fill out one form and everyone would be registered in that one process, where now they've separated it. You got two sections, two separate tiles. Just don't forget to do both. Otherwise, we don't want to see practices missing out on their patients, on their payments, and we don't want to see your patients missing out on their benefits as well. So, so that's it for today's presentation. I have also, we have been working on a cheat sheet. So a lot of those slides in the presentation of your screenshots will be in a cheat sheet, and that will go out to all practices in the next day or so. So keep an eye out for that. But we'll hand back to Malika and Jess, and we might be able to answer some questions if we've got any come through yet. Do we have any yet, Malika?
Yeah, so we've got one that's come through. So does the CTG, is it a one-off, and the registration for the PIP, is it annual?
Yeah, so your PBS one is a one-off registration. So that can happen from like birth right through at any point in time, and it's a one-off registration. A patient can opt out of it if they want to. But yeah, once only, and then your Indigenous health incentive payment, yeah, for the payment, that is a registration annually. Are there any more questions there?
Yep, so we've got another one. Can you please repeat the tier 1 and 2, how to be, that's not very clear, the second bit, but yeah, they want to repeat tier 1 and 2.
Okay.
So it's not really clear what the question's asking.
Let me just go back to my slide. Okay, so I'll just, I'll run through this one again quickly. So you've got to get your payment for your PIP Indigenous Health Incentive. It's made up of 3 parts. So when you first sign up for your Indigenous Health Incentive, you will get a practice sign-on payment. That's just a once-only payment. Then every year, when you register your patients, like what we just spoke about, so annually for all your patients that are over 15 years that have a chronic disease, your practice then receives another payment for every eligible patient. Then you have outcome payments. So they're broken down into tier 1 and tier 2 payments. So tier 1 is they have to have either a GP, MP or a TCA in place, and do at least one review of the GP, MP or the TCA in the calendar year, or do 2 reviews of the GP, MP or TCA, or contribute to the review of a multidisciplinary care plan for a patient in a residential aged care facility. And that's got to be done twice in a calendar year. So the practice will get another payment for that. And then for the tier 2 one, once again, for eligible patients in a calendar year, so a payment is made to practices that are providing the majority of the care for the registered patient, and that is done by any MBS item numbers, so 5 MBS item numbers, like services that are done in that calendar year. So if you're bringing your patients back 5 times in that 12-month period, well, you're gonna meet that target for your tier 2 payment as well. So I hope that answers your question. If it doesn't, feel free to contact me. I'm happy to go through it again.
So the next question we've got, can a patient just be registered for the co-payment measure?
Absolutely, yeah. Not everyone is going to qualify or be eligible for the PIP Indigenous Health Incentive, because you've got to be 1 over 15 and 2, you've got to have a chronic disease. So not everyone is going to be eligible for that, but everyone is, like, there is a criteria, and I'm pretty sure I outlined the criteria on the cheat sheet. But yes, patients can, so it's actually, I think I had it here in one of these slides at the start about who was eligible. So yeah, just on this slide here. So patients that self-identify that have setbacks in preventing or managing their condition if they don't take their medicine, or unlikely to keep up their treatment, yeah, or anyone that is enrolled in Medicare. So it's pretty open to majority of Aboriginal and Torres Strait Islander people.
I've got another question. We currently enrol re-sign paperwork on the anniversary of them joining. Should they be signed at a set time of the year?
No. So, well, there's 2 answers to that question. Yes, they can be registered any time of the year, because you're going to get your payment regardless. Like, as soon as you register a patient, you will get your PIP payment. But if you register between November and the 31st of December, it just ensures that you get your payment in the next quarter. So whereas, like, you will still get your like, some of your payments will come through quarterly with your PIP payments, and other ones will be annually. So if you register your patients between November and the 31st of December, well, then you will get your payment in, I think it's the February. But if you were to do it throughout the year, you may just have to wait a little bit longer for your payment. So that's the only difference, really.
Yeah, so the next one, so the CTG box on the scripts, will this still need to be ticked?
Look, you don't have to. It's not a legal requirement, but in the interim, I probably would suggest just keep doing it, only because I have had a little bit of feedback from practices that when patients are going to the pharmacy saying that they're not CTG registered, but until Medicare swap everything over and everything's running smoothly, I would probably suggest continue to do that.
Yep, the next one, ideally, who is meant to register patients for CTG, GP or administration?
So the GP should be registering the well, actually, hang on, let me rephrase that. The GP should be going through and getting the consent, like explaining the processes to the patient, getting that consent, going through like any health needs, like their 715s and so forth. Also, the nurse can contribute to that, but then admin, nurse, doctor, whoever wants to actually go into PRODA and do it, as long as they have got the delegation and the access to do it, anyone can actually register the patient.
Yep. The next one, if they've been registered for CTG at another practice and then they move to another practice, does it need to be done again, like re-registered?
No, not anymore.
Next one is, can you please repeat the 2 trials on PROTA?
I'm guessing it could be, oops, sorry, hang on, let me just go back. Sorry, I'm probably making you all dizzy there. So we've got this tile. So can you see that? That's your Closing the Gap PBS copayment register. So this is the new tile that was introduced on the 1st of July. So that's the one just to do your scripts, like to register for the PBS copayment. Then you have this next one, and this is your PIP incentive program tile. So this one has been around for years. This is the one where you actually register for the Indigenous health incentive, and that takes you to this section. Okay.
Yep. So next question, when a child is under 15.
Sorry, can I just say, sorry, Malika, I've got in the cheat sheet that will go out to practices, I've got all these screenshots in there, so you will all receive this.
The next question, when a child is under 15 with a chronic disease, what happens when the script is rejected?
Sorry, can you just repeat that one again?
When a child is under 15 with a chronic disease, what happens when it rejects it, the script rejects it?
Well, it shouldn't, because everyone is entitled, regardless of age, to have to be registered for the PBS copayment measure, so for their scripts. Yep. So it doesn't matter if they've got a chronic disease or not, and it doesn't matter what age they are. They can, they can be eligible if they've had that discussion with the GP.
Yeah. The next one are the payments from January the 1st to November.
I'm not sure which payments they're referring to, but your payments are based on calendar year. So 1st of January to 31st of December.
Yeah. Once patients sign the IPO 17, it then has to be scanned back into their file on top of filing it in the PROTA system.
Yeah, because you need to keep that copy of your patient consent, the signed copy.
Yep. How do you obtain the Closing the Gap PBS copayment register?
Good question. I don't know whether there is an actual register that you can view. You can view the register for your PIP Indigenous Health Incentive. So let me just go back a screen. So on this screen, see on the left-hand side, the small box where it says Indigenous Health Incentive Patient Registration. There's another little drop-down box under patient registration that says patient list, I think. Don't hold me to the wording, but I think it says patient list. If you click on that, that will give you all of your patients that are registered for the Indigenous Health Incentive. So all of your patients that are over 15 that have got a chronic disease.
Yep. So if under 15, they only get registered in the PBS on PROTA.
Yes. They can still have a 715 health check.
Yep.
At any age. You will still need to complete that paperwork because you still need to get the patient consent, and then you would just do them on the CTG tile, but you wouldn't be registering like on this slide that I've got up here now.
Yeah, I think that's the last one. Oh no, we've got another one. Do we have to register in both the PBS and CTG tile?
Yes, if your patient is eligible for the PIP Indigenous Health Incentive, yes. So if you've got a patient that presents to the practice never registered for the scripts, yes. Sorry, can you just repeat that question? Sorry.
Yep. So do we have to register in both PBS and CTG tile?
Yeah. So, so you would bring them in, have a consultation, complete your paperwork, then you would go in, you would register one for the PBS copayment, so that's for their scripts. Then you would go into your PIP tile and then register for the Indigenous Health Incentive, as long as they're over 15 and they've got a chronic disease.
All right, well, thanks so much, ladies. I think that's all we've got time for. Thanks everyone for sending in the questions. And don't forget that this presentation will be on our website in the resource library. Thanks, Heidi, and thanks, Malika and Jess.
No worries. Thanks, everyone.
Thanks, everyone. Thanks, Heidi and Malika.
Thanks.
No worries. Thank you.